Yes.
Okay. Perfect. As Jacqueline and Elizabeth said, my name is Chen He. I'm the program director at Mount Sinai Morningside West, which until just a year and a half ago was known as St. Luke's Roosevelt, in case you hadn't heard of Mount Sinai Morningside West. But we've actually been in New York City for a while. We actually graduated our 25th residency class just this past June. We have a lot of alums kind of around the country and around the world. I did leave my email address there because I may have to duck out of this session a little bit early. So if anybody has any questions, please feel free to reach out to me. So we are a 3-year program on the west side of Manhattan. We're only one of 2 3-year programs, the other one being Metropolitan. We are also a part of the healthcare system, Mount Sinai. So there's actually 2 residency programs in the Mount Sinai health system. There is the 4-year program, which is the Mount Sinai Hospital Elmhurst program, and then we are a separate program completely on the west side of Manhattan. And our residents primarily rotate at Mount Sinai West and Mount Sinai Morningside. So it's nice to be a part of the healthcare system because our residents really get access to kind of all of the academic resources that the Icahn School of Medicine offers. But in terms of a residency program, we have completely separate leadership, completely separate clinical experience. And so we kind of run a different residency program here on the west side of Manhattan. Speaking of which, I know that you guys are all kind of local to New York City, but I think one of the things that makes us unique on the island of Manhattan is that we are pretty much the only game in town on the west side. From the tip of the island all the way to Columbia Presbyterian, we're really the only hospitals on the west side, with the exception of one standalone emergency department that's part of the Lenox Hills Health System in the West Village. So a little bit about our sites. Mount Sinai Morningside, which is formerly known as St. Luke's, is located in Harlem. It's predominantly underserved minority population, a lot of Spanish-speaking patients. This is the busy trauma center for our system. And so this really has a little bit of a city-county feel, except we do have good resources in terms of ancillary care. And so not as strapped for resources as some of the other hospitals in Manhattan. This is Mount Sinai West. It's located around Columbus Circle in Midtown Manhattan. And this has a very diverse population. You get a lot of patients who kind of live in and around Midtown, as well as a lot of international tourists. It's next to the cruise terminals in New York City. And then you also do get undomiciled patients because of its proximity to some of the transit centers like Penn Station and Port Authority. And then there is an addiction institute here. So a lot of patients with substance abuse also utilize the emergency department. It's also the neurosurgical referral center for our healthcare system. So you get a lot of transfers in for that as well. So one thing I think that we really try to emphasize at the program is the clinical training, but also the sense of graduated responsibility. So this picture is just showing resuscitation that typically occurs in our department. And so we really try to have, our interns see the sickest patients when they're working with our senior residents. Our second years managing the airway. And then our third years run a team in the emergency department. So they really kind of get that attending experience for the entirety of their third year. We also start letting our second years run resuscitations halfway through, so January of their second year. So they get a lot more experience early on learning how to run resuscitations. The other thing I would say that is unique about the program is the ICU experience. A few years ago, we really wanted to ramp up our ICU experience. And so we talked to critical care. And so in the ICU, there's actually 1 to 2 EM teams. So ICU has 4 teams run by senior resident with junior residents. And one of the teams is entirely made up of EM residents. So as third years, our EM residents go back into the ICU. So sometimes overnight, there will only be EM residents staffing the ICU, which I think is a great learning experience for our seniors to be able to manage those patients with a lot of autonomy. We've also overhauled our didactics over the last few years. I have amazing APDs who work with me, Christopher Hahn, Jenny Beck-Esme, Felipe Serrano. And so we've really moved away from lecture-based conference learning. And so the majority of our learning in conference is actually small group didactics. So these are just some examples of what we may do in terms of small groups, where we have our residents broken up by class, and then we'll rotate them around. So they might be doing a procedure lab, or they might be learning EKGs in a small group, or they might be doing EM Foundations curriculum, or a journal club, and then they'll kind of rotate through so that there's more individualized attention to learning. And then I also just wanted to mention the fellowships that we offer on site. We have a 2-year global health fellowship. We have a 1-year simulation fellowship, as well as a 1-year administrative fellowship, which kind of allows our residents to have opportunities on all of those divisions. And that's it.
Awesome, thank you so much. Next, we have Dr. Ryan Bodkin from University of Rochester.
Good evening, everyone. Thank you all for taking your time to learn about our programs tonight. We're excited to be here. So I am Ryan Bodkin. I'm the program director at the University of Rochester in Rochester, New York. We are a really big, busy academic program. So we're a level 1 trauma center that's located in West New York in Rochester. We are the kind of only quaternary care center in the entire area. So we kind of take patients from halfway between Buffalo and Syracuse all the way up to the Lake Ontario northern border, down into the northern areas of Pennsylvania. Our catchment area is really large, and being kind of the only quaternary care center, we see a huge variety of different types of patients that come to our ED. We're the only level 1 acute care surgery center, so we see all the level 1 traumas. We are a stroke center, cath center, heart center, cancer center, ped center of excellence as well. So we have a huge variety of different patients that come to our ED for you to take care of and to learn from, and to really see the huge breadth of what emergency medicine has to offer. The 2 things I think we really excel at the University of Rochester, although I think we do a really good job at training you at all different types of things in emergency medicine, is pediatrics and critical care. I think we have a really robust pediatric emergency medicine department that's located within our center itself. So it's right in our department, kind of in the center. Although it's its own unit, the patients come in and it's kind of its own separate unit, but located in our ED. You get a huge, huge variety of different pediatric patients as well, being in the quaternary care center. So you see lots and lots of 6 kids and learn how to take care of them and feel comfortable taking care of them. And I said critical care as well. We have a huge number of different rotations in critical care outside of the emergency department, but we also have a critical care bay that's located within our emergency department. It is a 7-bed critical care bay that sees essentially the sickest of sick patients that come into our emergency departments. You work there starting in your 2nd year after you've learned really the kind of basics of learning sick from not sick and the basics of how to take care of patients in our ED, and manage this 7-bed bay that ramps up to 10, 12, 13, 14 patients at a time, of all sorts of different sick patients. So I think you get an incredible experience in those 2 specific things. We also know that about 60 to 70% of our residents that graduate go into some sort of community-based practice and not into academics. So we really want to foster that education as well. We have 3 separate community medicine rotations and 3 very different types of community emergency departments as well. You rotate at one of our sister hospitals, which is a big, busy emergency department called Highland Hospital. You work at a really small rural community hospital learning emergency medicine in that area. And you also rotate at a freestanding emergency department just outside of our ED, almost like doc in the box type of program, where you just have your attending with you and a CT scanner, x-ray, techs and nurses, and you manage the patients in there as well. So you really get to learn all sorts of different ways of practicing emergency medicine outside of the academic center itself as well. I'd also like to focus on our expertise, because I think mentorship is one of the things that I think we do really well here. We have fellowships in global health, education, ultrasound, peds, addiction medicine, and hopefully toxicology this year, which we've just applied for as well. So lots and lots of expertise in all of the different subspecialties in emergency medicine for you to get mentorship, to learn from, and then also to see if that's something you want to do in the future, and really help you get your career started off on the right foot to move you in the direction to get you where you want to be. We really focus on wellness and a family-like feel at the University of Rochester, and I think that's something that our residents would certainly attribute as one of the things they like best about our program. That's all. I speak really fast, I apologize.
All right, thank you so much. Next up, we have Dr. Manish Garg from NYP, Cornell, and Columbia.
Can I just share my screen here?
You should be able to.
All right, perfect. Okay. Well, thank you so much. I want to thank the NY Emergency Medicine Student Council for having me here, and also for my colleagues. I think that you are all about to embark on an amazing future and career, and you've got amazing programs here in New York City, and I really don't think you can go wrong. Let me share you a few thoughts about our program. The New York Presbyterian Emergency Medicine Residency Program, Cornell and Columbia. It's a 4-year, 12 resident per class program. We are located at 2 different sites, so it's 50-50. You have Cornell, which is in the Midtown East side of Manhattan, and you have Columbia, which is up in the kind of upper west Washington Heights area. So you have both a level 1 and level 2 trauma center. You've got both all the different types of disparities in terms of socioeconomic level, different types of folks that'll come to see you. We really feel like the model is set up. If I were to try to give you a few words that I think would encapsulate the program, we would love for you to know that we're developing family, we're developing people. We really advocate for our community. We feel very strongly about social justice, and we want to create leaders in the future of emergency medicine. I created a little QR code, and went a little QR code crazy here. So if you want to snap it on any of these pictures, you can get a chance to see our brochure, which has links to videos and some of our other details there. Just some big kind of themes about a place you should know about a program. You can see that we develop leaders, and I think all of my colleagues can attest to the fact that you are going to be the general of the largest working force in any hospital. So leadership development is also critical. So in addition to clinical medicine, we're also teaching you like executive building skills. So negotiations, conflict management, all these things are critically important. Social justice is so important. That's why we're the safety net for our community. We really want you to be a multi-talented person. So clinical care, research, teaching, advocacy, these are really, really important to us. And we have a lot of really cool innovations and improvements that we can kind of show you. And if you go to the brochure, you can see a few different examples of some of the kind of different tech and innovation things we have. Here are our residents. Kind of get goosebumps every time I see them. It's my family. You know, we're all on a first name basis. We really feel like our role is to develop people personally and professionally. And so, and for that reason, we really want to be involved in their lives. We love their diversity. We love their commitment to the community. We really feel like if you come here, you really have a chance to make a huge, huge difference and grow with a group of committed folks. So this is our fam. From a faculty standpoint, the key here for us is we have 200 plus faculty, all different types of training backgrounds, tons of programs that they come from. So you're going to learn emergency medicine, not from just one kind of swath. You're going to learn it from all different styles and backgrounds. And that's going to help you in your practice as you go forward. And that's going to help you as well with mentoring access. There's going to be like 3 or 4 different mentors that you're probably going to find. And we establish mentorship very early so that we can help develop your portfolio. Procedurally, we make sure that our residents get first opportunity for all different types of procedures on both of our sides, and it's been really, really well received. From a research standpoint, we have contributors, we have tons of NIH funding. If you're looking for something, we've got folks that are doing it, and we have a lot of committed people to research. And we have folks that can take care of all of that tough stuff, like the IRB, statistics, all of those things that usually can drive a person crazy when they're trying to get research accomplished. From a didactic standpoint, we are using flipped classroom models. We really know from a science of learning, you know, it's all about inception. How do you plant that seed into somebody's mind? We realize it can't just be audio didactic. It's got to be interactive. You got to experience it. You got to touch it, feel it, engage with the people that are learning. So we have tons of faculty members involved. We've gone to 30-minute sessions. We have all sorts of different things. We have a theme day where residents learn how to put a didactic symposium together, and they can choose it to do whatever they want. Here it's global medicine. We've done space medicine. We've done, I mean, you name it. It's been really, really cool over these last few years. We have 17 different academic practice tracks. We feel as a 4-year program, we have to develop your niche in emergency medicine. So from operations to sim, sports medicine, austere medicine, geriatrics, tox, critical care, social EM, humanities, you name it. Not only do we have not just like one committed person, we have multiple committed people of 200 plus faculty. So you really get an idea to really develop this skill set in you, and you can join them in the things that they do in the institution, as well as what they do nationally or internationally. COVID pandemic, I know, struck New York really, really terribly. I'll just say a few words about it. What we did for our residents was we tried to do a hear me, see me, like support me, celebrate me model. And we tried to make sure we were there for the residents. We're still there for the residents. We have all of the different resources for PPE. We do daily messaging about what types of things that they're supposed to do. It's been really, really difficult, and we've involved lots of our support services. So mental health folks, ethicists, we had a general from the armed forces come in and talk to our residents about how to navigate this. And as we go through this and as we go on, we continue to support one another with all the different creature comforts that you all deserve, because I mean, we love you so much. And one of the things that we decided to do was celebrate our residents. We put y'all up in the closest spot because we called you the frontest line doctors. And so we put you on social media because it's so important. From a diversity and equity inclusion, I mean, the one thing I'll just say is that if you come to the program, you will, I mean, it's New York City, you are going to be celebrated, you're going to be loved, you're going to find not just inclusion, but you're going to find belonging, because it's critically important to us. We remember with wellness how hard it is to balance your personal and professional lives. One of the things I can say as a program director that I'm most proud about is that, this isn't just about yoga. This is about like us making sure we're there for one another. So if a resident's having a great time, yeah, we're all there for you at your wedding or at your different, social event. If you have something hard or somebody's having struggles in your family, just as the same amount of people are there to call for backup or to call to be there. And we just really love spending time with each other in and outside the hospital. Our residents have been able to do tons of scholarly activities. You can get an idea of some of that if you check out the QR code. From a graduation standpoint, we've been able to place residents, even in the tough market, into really competitive places. We have all of these different fellowships that you can see, from healthcare leadership and management, global health, med ed, sim, geriatrics, peds, emergency medicine, ultrasound, and administration. We've been able to get folks in all different types of geography. And we realize that the commitment with us is lifelong. The programs have been around for 20 years. We've got a gigantic alumni base, so we can connect you with folks from all around. And we've been very blessed to be one in New York City, but also just the New York Presbyterian difference. It's a top health system with lots of resources. You've got Cornell and you got Columbia. You got a lot of motivated people who can put resources into things if you have a passion project. And that's what we're here to do, to support you. If you want to check out any of our website, the nypem.net is there. If you click on the QR code, it can also get you to any of these different things. So just wanted to say thank you, and it's an honor to be here. And I look forward to helping navigate. And I think I could probably speak for all of us as the faculty mentors here on this call. If you want to reach out for anything at any time, we want to be there for you, because we're so excited about your futures in emergency medicine. Thanks.
All right, thank you, Dr. Gard. Up next, we have Dr. Scott Leuchten from St. Barnabas Hospital.
Good evening, everybody. Thanks for joining us this evening. Excuse me. Congratulations on picking the best specialty in the world. We're truly all the PDs on the call. We're truly heroes, and we appreciate you joining us and wanting to learn emergency medicine. I'm proud to be the program director at St. Barnabas. It's in the South Central Bronx. We just welcomed our 31st intern class this year. We've been doing this since 1990. We're a 4-year program, and we train 15 residents a year. Give me 1 second.
That's that critical multitasking that emergency medicine folks can do, right? Like, go you, Scott.
Yeah, you'll hear my kids out there screaming soon.
My baby's out there.
No worries. My wife's also an ER doc, so she just went in for her night shift. So I have a little bit of time to just make this gap. Anyway, so I apologize for that. Anyway, 4 years, 15 residents per year. So we have 16 residents, 60 residents per year. This is our 31st intern class we welcomed this year. We welcomed our 32nd in June. We're a 4-year program, and so we do have academic tracks as well. We currently have 8 academic tracks with another one in development. And what does that give you? An opportunity to develop yourself, build your CV, learn what makes you tick about emergency medicine, find your niche in emergency medicine, whether that prepares you for fellowship, get you an area of expertise for your resume when you're looking for jobs. It's for you to develop and pick yourself. We're an academic institution. We have multiple residencies. We have a primary affiliation with CUNY, but we also have a community hospital feel. right? And so we have a nice feeling of community in the hospital. The residency drives the department, the emergency department for St. Barnabas drives the hospital. We're really important for the well-being of the hospital. And so the residency is really important. It gives us a lot of resources that we can use for this. We prioritize in the end of your third year and your fourth year being responsibility for flow and function of the emergency department. You're going to learn how to run a Florida emergency department. And so I think that's immensely important for your training. The majority of your rotations are going to be at St. Barnabas. We have what you're looking for, right? We are a trauma center, we are a STEMI center, we're a stroke center. We have all the patient populations you need. And so the nice thing about it is that you're working with each other. So even when you're on MICU or on SICU or on trauma, you're working with your colleagues and you're talking to your colleagues. And so you're building those relationships. It creates a strong sense of community and camaraderie among us all. We're interesting. So we have 30 core faculty and we have 30 faculty. All our faculty on camp on thing are core faculty. We treat them as core faculty. So every single one of them has teaching responsibilities, either mentorship, teaching. That means they're here for you. And so it's nice to have all of them have responsibilities in teaching for you. So it makes it quite unique. I talked about that academic hospital with a community feel. We have the ability to be leaders in department committees, hospital committees, and national committees. And I have 2 residents currently who are fourth years who are chairs of hospital committees. And it gives you an opportunity to build your leadership skills and your resume. And so that's an opportunity to do. And finally, we're dedicated to taking care of our community. 10457, that's our zip code, and that's what we take care of. That's our catchment area. It's a population that needs a lot of help. And we're there every day producing that help. And so it's a great place to train. We're known we're known to train tough residents. I don't dispute that. And it really makes fantastic ER physicians, and we're proud of what we do. Thanks for listening.
Okay, thank you. Up next, we're going to have Dr. Hussein from Northwell, Staten Island.
Hi, everyone. Welcome again. I guess we're back to doing this again. It seems like we just finished last season. But I really want to echo what my colleagues said, especially what Manish said. You can't go wrong training in New York City. There's a wonderful network of people. Most of us know each other by very well. I can text all these docs if I have questions, if I want to talk about it. Ideas that we want to do together. We do a lot of research together, and we also put a lot of conferences together as a group of educators in New York City. So first of all, the fact that you guys are looking for the New York City area is great. And thanks for putting this together. I want to talk about our hospital a little bit. We're kind of consider, I guess, one of the outer boroughs of New York City. So Staten Island, a pretty unique place. It's 500,000 people. So it's pretty much the size of Atlanta. And we're the only kind of large trauma center on the island. We're the only, with the large stroke center, with the large STEMI center, or snakebite center, burn center. Pretty much any sick patient on Staten Island you're going to get to see. And with that enormous catchment area, we have 2 of the large hospitals on the island. You really get to see a lot of the sick patients. And the nice part is you also get to really follow up because they're all going to come back. People really stay within the borough. They don't kind of shop at different hospitals. There's not that many options. And most people, don't want to cross bridges and tunnels to get their care. So you really have a unique population that you can care for. It's a mixture of a majority of time at a large academic trauma center, just like a lot of the other city hospitals. But we also have this smaller community site. It's about 30,000 people, 30,000 patients a year volume. You're the only doc there. You really get to practice what it's like to practice in small town America or anywhere. Go out and work in pretty much any resource limited environment. And that's great. You get to, 2 a.m. you have a dislocated ankle fracture, you're the one doing it. There's no orthopedics residency, there's no anesthesiologist, there's no any other specialist. It's just you and the one intensivist in the hospital, and you really get to learn those skills, learn what it's like, how to transfer a patient that's really sick, what patients can get transferred, what need to be stabilized. And that's a unique skill that you get to learn. Then I want to talk a little bit about our residents. There's a big spectrum of programs here. We're probably on the medium or smaller size program. We're 10 residents a year, 3-year programs, so about 30 residents. We have about 50 faculty members between our 2 sites, some that are kind of pure community docs, as well as a large amount that are faculty appointments. The group that we have, it's really a very family focused. We have residents that have kids, that have many of them that have some that live in homes. We also have residents that kind of live in Brooklyn, live in the city, kind of a really big mixture, but we really attract residents that want that close-knit feel. You get to, over the 3 years, you really get to develop very close one-on-one relationships with each other. Overall, Staten, wonderful place to train. You can read about us on our website. And hopefully, if you have any other questions, I'll put my email up. Feel free to email us. We are, from some of the faces I recognize, we're a core site for Coney and for Toro. So we do see a lot of students come through as well. All right, thank you.
Thank you. Next, we have from Albert Einstein, Jacobi, Montefiore, Dr. Mike Jones.
Hi, good evening. Thank you again for hosting and for having us. My name is Mike Jones, not the rapper. I'm the program director at Albert Einstein, Jacobi, and Montefiore in the Bronx. And for those of you who know who Mike Jones the rapper is, you'll recognize the lyrics there. Hit me up. That's my email. So a little bit about myself. I've been in New York for a real long time. I actually grew up most of my life here. Once upon a time, I was a medic, and I was a medic on 9/11. I was there at the Trade Center, and I thought that that was the defining moment of my medical career. It's what propelled me into emergency medicine. It's what made me passionate about this city and about helping it move forward. And boy, was I wrong. I think the past year have really made us feel, it's been a troubling and difficult year for all of us. And this is the defining moment, not just of all of our careers, but I think of healthcare as a whole and emergency medicine as a whole. So I really, while the rest of healthcare is crumbling, we are the ones that have been there really holding up the city, holding up the hospitals. And I really just have to stop and thank you all for literally running into the fire again, like so many people did once upon a time when I first found this field. So thank you. Jacobi, 1975. We are the oldest emergency medicine program in New York, the 3rd oldest in the country. We have always been one of the largest. In fact, we are now probably the largest at 21 residents per year times 4 years. There are more than 600 Jacobi and Montefiore grads spread out all over the world. Most of us are here in the New York area and the West Coast, but you will find us everywhere and anywhere. We've had our graduates at McMurdo Station in Antarctica, the middle of North Dakota, San Francisco, here in New York, everywhere. We have president of AAEM, the president of CORD, 2 of the directors of the board of directors for the American Board of Emergency Medicine, and 3 of the 5 emergency physicians who sit on the National Academy of Sciences, the Institute of Medicine. They're all Jacobi and Montefiore grads. Incredible people, but while that may sort of sound great, what I think really defines us is that we are also incredible clinicians. We come out of our training 4 years ready to handle anything and everything. I promise you all of the other programs out there in New York can say the same because we have something really special here in New York. We have incredible people, and we'll all tell you about our incredible people. We'll tell you about our faculty. We'll tell you about our residents, and they're all amazing and they do incredible research. They work hard, they play hard, they have a great time. They're incredibly diverse. But in New York, we have something else. We have incredible patients. And I will talk a little bit about the patients that we have because that's what defines your training at Jacobi and Montefiore. Bronx is 62. Have any of you heard of that before? And I can't really see everyone, but perhaps some of you have. What it is it's actually something quite deplorable. The Bronx County is the 62nd out of 62 counties in New York in the worst healthcare outcomes in New York State. And that's something to not be proud of. But for us in the emergency department, it gives us an opportunity to help our community. Let's be honest, nobody wants to come to the emergency department. They come because they have to. They come because it's the last place that they can go to. And that's what we do in the Bronx. We are the sort of last bastion of hope for our patients. And we are there to help make someone whose worst day just get a little bit better. And so we do that every day. We're in 3 different hospitals and emergency departments. Jacobi, a level 1 adult trauma center, a level 2 pediatric center, a city public hospital. We have a private partnership with Montefiore at 2 separate emergency departments, the Montefiore Moses campus, which is a quaternary care center, one of the busiest single emergency departments in the country, well over 135,000 adult visits, and a pediatric children's hospital attached to it. We also work at the Montefiore Weiler campus, which is a community emergency department where you see adults and kids right next to each other. Community in New York, by the way, means like 75 to 80,000 visits, not community in rural areas, which means like 5 to 10,000 visits, but still nonetheless has that flavor of a community feel, a small time ED. And that diversity of training in different sites is really what I think highlights your education with us. And on top of that, the diversity of acuity and pathology that you will see in the Bronx is unparalleled. We are one of the poorest zip codes in the country. Gang violence is rampant, poverty everywhere. The COVID pandemic highlighted the incredibly disturbing disparities in our community, the Bronx, in terms of access to care, and other healthcare outcomes, but also even further, the incredible other part of the pandemic, the just terrible race protests and the Black Lives Matter movement that happened last summer. And we were there for all of it. And we were there to help our community in the Bronx. Just a couple other things about our program. We have a bunch of other kind of the bells and whistles, but that is to me really the heart and core of our program. But the bells and whistles, we have fellowship programs. We have an incredibly robust research division. We have a pediatric emergency fellowship, not just one, we actually have 2, one at our children's hospital and one at our trauma center. We have a research fellowship. We have an incredible ultrasound fellowship, actually is one of the oldest in the nation. And we have a simulation education fellowship as well. The last thing I will leave you with, just to mention, at the end of the day is you all want to be amazing emergency physicians, and you all will. You all will be, and it doesn't matter where you go, because I know all of the program directors here, and they're all great people. They train great residents. The one thing I will sort of tout about my program is 21 residents graduated last year. 21 of them had jobs in a very difficult job market. They had them fairly easily, and every one of them is actually taking a job with one of our alumni. And that is something that's really incredible for us, is that we have an incredible network to rely on and to dig deep into to help support. And that network reaches well over 45 years. So I put my information in the chat. You're welcome to email me. And I wish you all the best of luck. It's going to be a very difficult year again for all of us in trying to figure out who we like and who you like. It's really it. But I promise you it will work out. And please do reach out to all of us if you have any questions and want to, are looking for answers. Thank you.
All right, thank you, Dr. Jones. Next, we have Dr. Arlene Chung from Maimonides.
Wow, great pronunciation. So I think one of the hurdles that oftentimes people are like, oh, how do you pronounce that place in Brooklyn? You can go by Maimo. That is how we affectionately call our program. So my name is Arlene Chung. I'm the program director at Maimo. I've been there now for 4 years already, which is fascinating to me, that how fast time flies. I put up one slide. I have one slide. It's a lot of stuff on it. Most of everything is available on our website, so I included a little QR code at the bottom. I'm sure I'm sure you're feeling the same way that I am, and just like, wow, these are like amazing programs, so much information, and every program seems awesome, and I can't match it every program. So you should feel really good, as has been highlighted, that you chose emergency medicine, and particularly emergency medicine in New York State. Hi, Ryan. Which is a great place to be, right? And we're all friends and we're all buddies. And really, I think as a group of us, and hopefully this will be highlighted in the Q&A, our job is really to help you find where you fit the best, right? And it's not so much that, one program is objectively better. We're all different and we're all awesome in different ways. And it's really just a matter of fit and what works with you. And so that's something that I think for the fourth years who are here are going to have to sort of do a little bit of internal soul searching over the next couple months. My other piece of advice actually would be, you're hearing from the program directors, but honestly, I also think that you should try to find time to talk with the residents too. We sort of give you like the 10,000 foot view of the program and some of the alumni, the history and all of that, but the residents will probably give you a little bit more insight into maybe what the day-to-day life looks like, which I'm sure you're all very interested in. As far as our program, here's like the nuts and bolts of it. We've been around for a reasonably long time. We're like a mid-sized program for New York. Maimonides has the distinction of being the biggest hospital in the biggest borough and the biggest city in the country, right? Which is sort of no surprise. We care for a very diverse population, every other program in New York City. Although I will say that one of the different things about our program perhaps is that we're primarily located at one shop, right? So our residents spend the majority of their time at the mothership at Maimonides. And the reason that they're able to do that is because we have all comers. So we take care of a population of patients that could be described as traditionally county, right? So very underserved, heavily immigrant population, which is reflected in our 200 plus languages. But we also are like a tertiary care receiving center, and we get patients with LVADs, and we get patients with transplants, and we're a level 1 trauma center, and we're the only pediatric trauma center in the borough of Brooklyn. So our residents really get a wonderful mix of patients who come to us. Some other highlights, there are no floor months, there's no medicine floors, no pediatric floor. You get to spend a month in shock trauma to enhance your trauma experience. Not only do we provide a dedicated international rotation, we also provide a 4-week senior elective in the third year. We have a bunch of fellowships that are available, including a administration fellowship and an EMS fellowship that are coming this summer, which is really exciting. And some really extra bonus stuff. Our residents get probably I would say of all the divisions, I would say ultrasound is probably the strongest. We have a live TEE that is deployed in our resus bay. Our residents get very facile and things like ultrasound guided nerve blocks. And just for reference, I think on average, so the ACGME only requires that you have about 150 ultrasounds by the time you graduate. Our residents graduate somewhere in the neighborhood of 400, 500 ultrasounds on average. As I mentioned before, over 200 distinct languages. Our residents get very comfortable with medication-assisted treatment and prescribing and administering buprenorphine. Emergency department. We are one of the few programs that actually covers events in New York City. And so all of our residents have the opportunity to moonlight at Madison Square Garden. So we cover all the events at Madison Square Garden. We cover the US Open, we cover Barclays Center, we cover a lot of local concerts. So if you really want to go see Lady Gaga, and she's coming back to concert back when those things happen again, you can just say, sign me up, and you get front row seats and get to help out taking care of any of the patients who may arise in that huge stadium. We are the only EM residency program that provides care at Burning Man. Again, sort of, in the future when things sort of come back to normal. We have a social EM division that is robust and very involved in the community. We have scholarly tracks. So as a 3-year program, one of the unique things that we offer are scholarly tracks that include things like medical education, simulation, ultrasound, and the medical humanities, as well as social emergency medicine, critical care, and EMS. We have a diversity and inclusion committee that is very active. The residents are super involved. We have a number of initiatives ranging from first-year medical student opportunities to opportunities for fourth-year medical students to supporting our current residents. And we have a very robust wellness committee as well that is multifaceted. And again, the residents are very involved with that. I'd encourage you to check out our website. A lot of the details of that, it's okay if you don't remember it all. And actually, we have a webinar that's coming up on Tuesday. So for those of you who are free on Tuesday evening, you're welcome to join us. We're actually going to be talking specifically about all of the diversity and inclusion initiatives that are going on in our program.
Okay. All right. Thank you. Last but certainly not least, we have Coney Island with Dr. Rizzo.
Good evening, everyone. So I am not Dr. Zhang. Our PD had an emergency, so they pulled me from the benches last minute to fill in. So I don't have any slides, and I'm pretty much just going to talk from the heart. So we are, if you want to talk about individualized programs, we're the new guys on the block. We've been ACGME accredited for about 2 years. We've graduated 6 classes. So prior to that, we were osteopathic. And there's something to say about a small program. We have 12 faculty, half of them are fellowed. We have a very, very open door policy where residents can come to us for virtually anything. We allow the residents to try to adjust the conference based on what's going to work best for them that year. Or during a pandemic, we were able to do a lot of flipped classroom stuff. So the residents have to worry about either going in or traveling to the library or doing anything they didn't feel comfortable about. We have a new hospital that will be opening up in summer 2022. It's going to be renamed to South Brooklyn Hospital Center, and we are still be part of Health and Hospitals. So during that time, it'll be a new experience. We'll have brand new toys, 90-bed ER, and it'll allow us to really kind of grow together, not only as a new program, but in a new space. It's a 4-year program, and the rotations typically go between Harlem Hospital, Jacobi, Kings County. So you really get a great feel for New York City and the people that live here and that serve. We typically take care of the people who can't go anywhere else for care. So we don't ever have to worry about a patient having to pay for a bill. It's always care first and disposition later. Outside of that, our 4th year is often a leadership track. So you often get to play the leadership role in the ED, as in running all codes and traumas. You also get to do a lot of electives, about 3 months of elective time to travel internationally or locally. On day 1, you work one-to-one with an attending. So you don't answer to a senior resident. You don't get thrown into the asthma pit or the triage area. You are working in the critical care zones on day 1. Typically for the first 6 months of the year, we put a senior resident as a teaching attending that floats around to make sure that everything is going okay. But really the most important aspect of our residency program is the family dynamic. And we spend a lot of time together. We do a lot of things outside the hospital together. And we make sure that if you guys ever need anything, we're always there for you. So if you have any questions, I will kind of place my email in the chat box, but otherwise, thank you and have a good night.
Great, thank you. I actually do see Dr. Caputo here, who is from Staten Island Hospital. I know Dr. Hussein already gave his whole spiel, but if I just wanted to give Dr. Caputo a chance to add anything if you would like.
Thank you, Jacqueline. So yes, I'm Billy Caputo. I'm the PD at Staten Island. I have a great team, Dr. Hussein being the associate program director. So I'm not going to repeat anything that he said, but just a quick thing about Staten Island, we really look for people that are going to fit in well. And we wish all of you guys had a chance to rotate because I think we really have a special program at a special place. So please just do me a favor, check out our website, check out our lectures, and speak to our intern class and any of the students that come through. Looking forward to seeing all you guys, and thanks for having us. And I'm sorry my shift got changed. I'm in the middle of working, but thank you.
Okay, thank you. I just wanted to give one last thank you to all of our panelists. Thank you so much for taking the time out of your very, very busy days, both in the hospital and outside of the hospital to be here with us. It's incredible to have amazing programs throughout New York State here. Just wanted to add that the audience members are kind of from all over the place. This is not just New York. So we have people from Florida, Pennsylvania, Virginia, California, all here. So, thank you so much for coming and speaking about your programs. I'm going to hand it off to Liz now, who's our chair, and we're going to go straight into the Q&A.
Yeah, I just wanted to echo my thanks to everyone for spending your time with us this evening. We did have a number of questions sent in, both about the application style and also about specifics to the residency programs. So let's jump in. The first question is, will interviews be completely virtual this year? And if so, will there be a chance to do a virtual tour or in-person tour for students who did not get a chance to rotate at the hospital? And this is open to whoever wants to answer.
So I'll jump in if you guys don't mind. I think most of us are doing their own thing, although the national recommendations from the COPA guidelines, my current understanding is we're supposed to be edging towards virtual. Jacobi and Montefiore will be virtual, and then we're going to hopefully, fingers crossed, be able to allow some in-person tours.
Yeah, so I will echo that. So the recommendation is 100% virtual. And the programs this year, in general, you guys will get the virtual tour during your interview days. Some different programs have some different setups, but usually you're interviewing while people are touring, so you get to see the space. We want to make sure that if you're strongly interested and you want to come by, as of now, it's going to be open to coming for looks or second looks, because I couldn't imagine going to a place that you've never been to and just rolling the dice. So that's something that's available now.
Thank you. And I'm seeing that some PDs are answering in the chat as well, so that's very helpful. Is there any information about any virtual social events where we can get a chance to meet the residents or get a better idea if we're a good fit for the program?
I can jump in here. If you follow our webpage or our Instagram, we have a lot of information about social events. Like Arlene said, happy hours, things like that with the residents, with our faculty members. Also, EMRA runs a really good residency fair where they give you individual chances to meet with different program directors. We will have a residency candidate on that as well to have 10-minute interviews and presentations from them as well. So I think that's another good opportunity to get a chance to meet with our residents and learn a little bit about from their perspective, which, like Arlene said, is incredibly important for you guys to see the perspective of the residents outside of just what we're trying to tell you about our programs.
Awesome. And if any program wants us to share on our social media as well, we're happy to do that. You can just send us a message. Next question is, what do you think about the guideline to only do 2 away rotations in EM? Will you look down upon students who have completed more than 2 EM rotations?
I can answer that. So our primary concern is character. We feel like we can train anyone who is willing to learn in emergency medicine over 4 years. So that's not our major concern. Our major concern is personality. And if, there are certain personalities that will fit and certain personalities that won't fit in every program. So I think that it doesn't matter how many rotations you do. I care about who you are as a person. I care about how you present yourself. And I care more about your life experiences and what they meant to you over a board score or a bad grade in med school or a bad rotation.
I think I saw Dr. Chung and a few other people mentioned in the chat the notion of equity. I think that's one of the things we're all really concerned about this interview season is how do we make it equitable, both with the tours and then understanding that away rotations it's a rare resource, and we hope that everybody has followed those guidelines, and there is a caveat in there that if you have special reasons for doing more than that 1 or 2 away rotations, you should explain it. And I think we're all pretty reasonable that that's, that'll be okay.
Great. Our next question is, how can students who are not always interested in EM stand out on their ERAS application if they did not have many EM related activities during their preclinical or earlier medical school years?
I think it's okay to be a latecomer to EM. And actually EM is maybe the one specialty where it's like not such a bad thing because you have to know a little bit of everything anyway. I actually thought I was going to be a cardiologist until like I don't know, March of my third year, I think. And then anyway, clearly it didn't pan out that way. So that's okay, right? And I think, the ways to make yourself stand out, it's all the same advice that you've been getting, right? So do well on your EM rotations, do well in general in school, like have some interesting hobbies outside of medicine is always helpful. Write a great personal statement that really highlights your interest in sort of taking care of these populations, and you'll be just fine.
I also think that finding mentorship within the department at your shop, hopefully you have that there. I mean, that goes a long, long way. I mean, I think, in some of the medical schools, you don't have an opportunity until your fourth year. That might be starting as late as July. So we understand as program directors that folks are coming from all different backgrounds. And just to kind of support what Arlene said, like, I loved everything. I think just like probably all my colleagues did. I was just like, sign me up, and then, it finally took until March or April when some emergency medicine folks took me under their wing. And we're like, and I was like, yeah, this is it. And it took my first couple of shifts. And then I was like, yeah. So, find a mentor, find somebody there, communicate to us. If, there's a program that you're interested in, or if there's residents you're interested, reach out to us. I think that shows your interest, and you can craft something that's really well. And then just like Arlene said, like jam on all of the things that are in front of you. Don't worry about the back part, look forward.
Awesome. And we just have a question in the chat here. Do subspecialties like PEDS EM or EM ultrasound count towards the 2 SLOE maximum?
The too slow is actually for departmental emergency medicine. So these are considered subspecialty, like slows. So no, they don't count towards that. You can have 2 departmental emergency medicine slows, and then those can be helpful to you and supportive too.
Okay, so now we're going to transition over to our residency program specific questions. So the question is, in addition to successful grades or board scores, what do you most value or look for in residency applicants?
So I could take that one. So I think a lot of us are the same. So you'll hear a lot of the same answers. So knowing you could pass the test is great, but you kind of want to have a feel for your residency program and who's going to fit in the best. Slows are also very important. So your emergency medicine slows with certain things like how hardworking you are, how well you got along with the team, also important. But it's also kind of the feel and what we look for in a resident that make sure that match is right.
I think there's another piece to this too, is that you've probably been, throughout your career at this point, willing to donate bodily organs just to get into whatever program that you're going to try to get into. And at this point, you're going to love that there's so much more reciprocity. You're going to have us on our side being like, wow, you've done this and this and this, and this really, connects with our ideals and our vision and our mission. And I think that, you're seeing it like fit. And when we're saying fit here, we're talking about finding somebody that not only is going to really take take great care of the patients in front of them, but really utilize the resources of that particular program, and that they're going to keep wanting to do that and kind of be a star in every different dimension. So I think that's, what we're looking for. So, I think people get worried about some of these maybe traditional markers. And I think what's been really great now is that because of the change that's happening in interviews and what's happening in how we review applications, we're really looking for people. And so if it's board scores or if it's other stuff that you're worried about, I think you're going to really be much more happier this, as time goes forward, because a lot of these maybe other markers that maybe have historically excluded folks, that's not something that we're looking for. We're really going deep, and we're digging deep into your applications to figure that out now. And I know that in terms of all the conversations with all my great colleagues here.
Yeah, I would agree with that, and also say that every program has its own personality, as you will see when you're starting to interview. So this idea of fit, might seem more theoretical now, but when you start to interview at these programs and meet the residents, which is really a very important piece of the puzzle, you'll see that you will fit in different places better than others.
I just have a quick general question. So step one has not yet become a pass fail, but are you guys sort of like inching towards that idea as you review this year's application and next year, even now, although it's not yet pass fail, or are you still kind of like, oh, it's the last time, let's just, look at these word scores and use that to let people in?
I think all of us have a different rubric with regards to the step scores. I have to be honest, good step one test taker to me never equaled a good doctor, nor did they equal a, fun person to hang out at 2 a.m. on a Friday night. But I think we're all going to be a little different on that. I'm not really. I pass it. That's pass it eventually. That's
If you
really
got a
it.
good step score, you should still apply to his program. Like,
Yeah, that's the other thing. Yeah, sure, definitely. Thanks, Arlene. Apply everywhere, but it's everybody has their own flavor, so tough to say.
A lot of you mentioned personalities of your programs. Do you guys mind sharing what you feel like the personality of your program is like?
So I just wanted to say one thing about the last question. So the order we look at people's applications, typically we go to your SLOs first. We read through your SLOs, and then afterwards we'll go to your hobbies, and then we'll go to your personal statement. So once we get through those three parts, we feel like we know you pretty well. And then we go back and look at your scores. And if there's a major red flag for some reason, and it's explainable, then that's fine. But I think for us, that has brought us some of our most interesting and productive and have created some really great doctors. So we've continued that process. Sorry.
I like what you said, Dr. Chung, in the chat about the personality of my room. Can you talk more about the culture of the program? Like, how are interns oriented into the residency? Do they feel comfortable with the responsibilities coming in? And what's the dynamic like between the different years of residence?
So I could jump in on this. We do a pretty extensive orientation program. We really want our residents to come in and be well integrated into the systems of how we work, as well as integrated into how we do things at the University of Rochester, including getting to know their colleagues in a really good way to be supportive for the next 3 years of the residency program, which is really challenging, but really fun at the same time. So we have a 5-week long orientation program. You're immediately lined up with like a big SIB, older SIB type system between the 3 different residency programs, as well as a faculty mentor as well. We do lots of social events, lots of get-togethers, but also get everybody up to speed. As we all know, the tail end of 4th year is usually less than rigorous, as we will call it, and getting everybody back up to working on a daily basis and understanding the basics of emergency medicine before they kind of jumpstart into their regular rotations like NICU and ICUs and things like that is really important to us, so that our residents are comfortable, have support systems in place, and are ready to work and learn from their first rotation. So we put an extensive amount of time into our orientation to allow for that, and we think it really pays back dividends for the next 3 years with the support that our residents are able to give each other.
Yeah, I'm going to echo what Ryan's saying. The transitions are critically important just in life. And when you're first coming into a shop, if you invest in that early part of time, it makes such a difference as you go down. I mean, I personally give like a full half a day's worth of talks to our interns. I talk about taboos in medicine. I talk about how you're actually supposed to chart, not what they taught you in medical school, and that way you can do like, be safe while you're charting, while making sure you're doing all the right things. I talk about how to read EKGs and chest x-rays, which is probably the first things you get, how to pick antibiotics, how to do, some of these like critical procedures that, might be difficult. The things that I've seen over 20 years that can actually make or break. We talk about like the really tough things that can happen, how somebody's going to take care of that aortic dissection on their first week, and kind of what type of wellness resources and support we have for you there. So I think that it's really, really important, and you invest all different people in your orientation block to try to make sure that people feel supported, they have fun, they get connected. I think that those things are really, really critical. So transitions is something that we focus on, even with graduated responsibility. And I think that I think in EM, we're really good about trying to be very, very person-centered and trying to make sure that we're looking at the end product, which is you all, to make sure that you feel support, because you are our greatest asset in this whole thing, trying to make sure you feel supported and you feel like you're ready to jump to the next level.
Hi, my name is Evelyn. I was the chair last year. As a DO applicant, I wanted to be the one to ask this. So we were wondering how DO friendly your programs are, whether or not you've had some in the past, as well as some students have messaged us asking about international medical graduate friendly.
As originally a DO program, our first PD, Dr. Regina Hammock, is pretty well known through New York City. She trained at Barnabas and has worked throughout the city over her career. She always was super proud of being not only a Black woman, but also an osteopathic doctor. So we have followed in her footsteps and have continued that process of putting DOs on a special place near our heart. So we are definitely DO friendly. And most of our faculty are DOs too. I would say about 2/3 are.
Yeah, Barnabas was a traditional osteopathic program. Did that for the first 25, 26 years of its existence. We have osteopathic accreditation through ACGME for those who are interested, who are osteopathic candidates to the ED as well. So we maintain our roots strong, but we love all candidates.
I agree with that as well. At Staten Island, our last class, we're half DOs, so 5 DOs, 5 MDs. In our class, we have graduated foreign medical grads as well. So we really look for the best applicants at our program.
Awesome. Some students were also interested in how involved EM residents are during trauma resuscitations. Does the trauma surgery team take charge in these situations, or is there some sort of shared decision making, and how are procedures divided?
I'll go for this one. So we're a level 1 trauma center, and we're the only pediatric trauma center in Brooklyn, which is about 500,000 children. So we get a lot of transfers as well. We have the nicest trauma surgeons, and that was actually one of the foundations for building the trauma program at Maimonides, which actually is relatively new within the last 5 or 6 years. Our procedures are divided by body side, which is kind of interesting. So the surgeons stand on the left side of the body, and the EM resident stands on the right side of the body. So it just depends on what side the pneumothorax is on, or on what side the procedure needs to be done, which generally is how we divide it up. Airways always go to our senior. For the level 1s, anesthesia will usually poke their head in the room and they'll be like, do you guys need me? Are you good? Okay, peace. Yeah, see you later. So there's usually never a problem with that. But I think, yes, Ron's he's such a nice guy. I met him and I was
he was our trauma surgeon once upon a time. I will actually, so I have a slightly different hat in the world of medicine, in that I am one of 8 or 9 emergency physicians in the country who is a consultant for the American College of Surgeons Committee on Trauma. And so this question comes up all the time, and I just want to kind of diffuse a little of your worry out there. The fact of the matter is if you are a verified trauma center, which in New York State, we have transitioned over the past 5 years to all trauma centers having to be verified by the ACS, which is the American College of Surgeons. There are rules from the ACS, and that is the direction that unfortunately, the whole country has gone. So you will find, by and large, across the country, that there is some variety of a split, that in most major places, particularly in New York, EM is a strong entity. We almost always control the airway. In very rare situations where that's not true. And we, by and large, have a majority of the leadership and the procedural skills in all of the traumas, and that's across all the centers in New York. And I will tell you that is pretty much the norm as you sort of spread out into the big metropolitan areas. Some places where emergency medicine is just kind of popping up as, in terms of residencies, you'll find that the emergency medicine residents wind up rotating a little more on the trauma service. That's kind of a bigger view on the national perspective from the trauma world.
Alrighty, and also thank you to the PDs who are answering in the chat. So students, just make sure that you're monitoring that as well. Our next question is, how does your residency plan to adjust for the projected surplus of EM physicians in the next decade?
Sorry, I just finished writing something in the chat. I'll actually say something. I mean, this is obviously something that's been of concern with our current residents and our recent graduates. I mentioned briefly before that we're a little bit unique as a 3-year program for offering scholarly tracks, and there were a number of drivers behind that, but actually the workforce was one of them. And if you've read the report, there's a number of sort of solutions and there's a number of proposed avenues, but one of them is really expanding the scope of care that emergency medicine providers can give, right? Because we have this unique skill set. And so that's just like one concrete way. Obviously, we provide job advice, and I'm sure many of the other programs provide job advice, CV advice, cover letter advice, interview advice as well to really help bolster our grads.
So I would also say that, we talk about a lot of patient advocacy. I think it's also critical that we talk about emergency medicine physician advocacy too. And so I think a lot of our folks here, but definitely myself, my professional society in emergency medicine, we take kind of like this is a kind of the bull by the horns charge here about trying to make sure that we have a voice. I advocate with senators, I advocate with my professional society about trying to make sure that these jobs for physicians who are going to be doing, 20,000 plus hours, that you have a voice, that you have a place, and that you have jobs. And so those things are critically important to all of us. And so, in my free time, I'm making sure that I'm, calling, people that either if it's at a professional society level or if it's at a political level to make sure that our residents are represented and that that they're spoken for. So I think in addition to, having the great alumni and having that really wonderful network to reach out and to developing this awesome skill set, I think this is a familyhood of emergency medicine. So, it's not just my program I'm advocating for, but I'm advocating for everybody's program. And so I think that it's really important that we do that and that you realize that even though you're a physician, at least I feel that there is an obligation to actually speak for us as physicians out there and make sure that even in media that they understand what's there. So whether it's on the radio station or on television too, I make sure that, we're talking and and people are listening. And it's important that, you get really wonderful care from somebody who has that experience.
Alrighty, so those were the most commonly submitted questions that were submitted beforehand. Now I'd like to open the floor for any student who'd like to ask any questions before we move on to closing remarks. So if anyone has questions, feel free.
Hi, I have a question. I'm Tolu Akinshola. I'm a 3rd-year medical student at Toro Middletown. My question is, as a DO student, would you recommend that I not only take not only take USMLE Step 1, but also USMLE Step 2? Or is it okay if I just take Step 1 and stick with COMLEX? Thank you.
I can jump in from my standpoint. I think like Mike said earlier, I just care that you can pass the test, right? So if you can pass step one USMLE, if you can pass step one complex, that's all I really care about. And, that's the most important part for us. So I know a lot of the emergency medicine programs across country are doing similar things where you want to see that you can pass an exam, but it does not dictate how well of a doctor you're going to become. So pass one of the tests, do as best as you can on it, and move forward with the licensing that requires, right? There's no need to take 6 different tests. Take the test that you're most comfortable with, do well on it, pass those exams, get licensed, and we're happy to accept applicants with just complex, just USMLE, or a combination of both.
Yeah, I agree,
go
agree
ahead.
with that.
Go ahead,
Sorry,
Mike.
Mish,
Yeah.
go ahead.
No, I was just going to say, like, we recognize the financial burden that this unnecessary testing puts on all of our, I mean, that's why so many of us advocated against trying to make sure that had the video, the SVIs, the video thing that you were supposed to do, the video interviews, because we were worried that a lot of that was going to end up becoming an additional cost to you. And so I think, again, what Ryan said, go ahead, do the best you can on that test, the one that's in front of you. And I think fortunately for you, it might be that step one, I don't know if step one may not be required for you, but if it is, just do your best on it.
Thank you all so much.
Hi, my name is Nishat. I'm also from Truro Middletown. My question is, now that the USMLE complex, everything is leaning more towards the pass-fail system, how would you recommend those who are applying into EM residencies, how would you recommend that we try to stay, stand out in our applications? Anything specific that you have seen in your previous residents who, really excelled in your program? Thank you.
Show us what makes you unique. That's what we want to learn about you, right? Showcase what makes you unique, what makes you interesting, what makes you a good fit for emergency medicine. If that's leadership or volunteer or an experience there, that's what we want to see. Because again, and many people have kind of talked about it. We want people who are going to do really well in the specialty.
Hi, good evening. I'm Nana Kwame Darkwa. I go by Kwame. I'm from Ross University School of Medicine. I'm a 4th-year medical student. I have a question for the program directors. First off, how has it been being a program director in 2020? And also, what advice do you have for your residents or for a medical student that's hopefully aspiring to be where you are?
I think being a program director in 2020 has been hard. I think we are all ready for a little vacation, but I have to be honest, it's not as hard as being a med student in 2020. I feel for you guys. It is so difficult. The world has been turned upside down. Your career trajectory, your lives, everything that you've worked for 20 plus years is up in the air. And anything that we can do to help you and help support that, we are here for you. But I think that covers the first half of your question. So
I will jump in on the second half for you, Kwame. So there's not really a manual to follow once you become a resident and then an attending to kind of get to a PD. A lot of times I just thought about what I was around that I could help out with and just took projects on and built up my skill set. So that was with teaching, with ultrasound, with everything. And then once you graduate residency, a lot of times you just need a break. So for my foot in the door was the director of medical student education opened. And then once you take that job, you have to do it better than anyone before you's done it. And then you tend to leapfrog and go from position to position and move up the ladder. But you really just have to be awesome and people will recognize that. And if you're willing to work hard and make things happen, just be yourself and make things happen. But if you want to do something and it feels right to do it, just do it. A lot of the things I started, people didn't ask me to do. I just thought it would help, and I started projects, and a lot of them ended up panning out.
Thank you guys for that. Any other PD, if you want to chime in, please go ahead.
I think one of the things I love best about, oh, sorry, go ahead, Manish.
No, Ryan, go ahead.
Oh, I was just gonna say, I think one of the things we all like best about our job is mentorship, and there are incredible mentors in emergency medicine. People really like to give their wisdom and help you move along. Sorry, it's gonna be creeping up on me here. And so, you know I like that about my job. I know that was incredibly valuable for my position in moving forward in my job of finding good mentorship and people that want to help you along your way and be a sponsor and help you to get where you want to be on your pathway. And I know that CORE does lots of resources. We are all resources for you. So find someone that has the job in front of you, learn from them. How did they get there? And then mirror what they do and try to do the best you can, and you'll get to where you want to be. There's lots of good people out there that want to advance you as much as they want to advance themselves. So I think that's a really great thing about emergency medicine, that we all want each other to move forward and do better. So it's one of the fun parts about our job for sure.
I mean, I would say that the pathway to get here is a lot about the hard work, but it's also just about luck and timing, you know, at a particular shop and just when something could just be open. But I think, you know, and I know I'm sure I can speak for all of us here, but just want you to like, just take a moment and think about it. Like, we get to not only take care of unbelievable patients, we get to actually mentor people. And our goal is to try to actually inspire you as a trainee, as a mentor, but actually you inspire us. Like, we get a lot of energy from our trainees. And so we get to be not just the administrator, but we get to be the friend, the teacher, the advocate, the champion. You know, we get to do that and have that relationship with another human being and watch them grow and build into something just so special. It's going to take care of so many people. I
think your audio went out.
AirPods died. Oops.
Thank you, guys. Thank you.
So hi everyone. Oh, how do I? Okay. My name is Huakan Huang. I'm a fourth year medical student from Stony Brook in Long Island. So thank you so much for sparing your time to give us this wonderful panel tonight. I do have a question actually, because a lot of program directors tonight mentioned about the fellowships and at least the academic tracks to fellowships. And also I've seen many EM resident graduates have taken fellowships instead of directly working in a hospital. So it looks like more and more people are doing that. I was wondering, do you guys think that doing a fellowship is like the future of EM? And also, do you guys want the applicants, medical students who apply programs now, have an idea of what they want to do already? Because I have a lot of like areas of interest. I don't know which one I want to do yet. Thank you.
I think there is a general specialty trend toward more and more fellowships if you look sort of broadly across the country. And I think that's just as like the scope and practice of emergency medicine has expanded, right? So you have to remember, EM's a young specialty. We used to just be like sort of the basement of the hospital, but now we're doing lots of stuff. We're doing telemedicine, we're doing simulation, we're doing teaching, we're doing ultrasound, we're doing sports, we're going to, you know, DC to do advocacy. We're doing lots of different things. And I think that sort of naturally lent itself to a bunch of different fellowship pathways. Is it going to become mandatory, or is it going to become, or are we going to turn into internal medicine where, you know, you have like, you know, all of these things and very clear cut pathways? I don't know, right? I don't think any of us can predict the future. I think what Mike said, if you're interested in doing a fellowship, you should do it. If you're not interested, don't do it. Because I think, you know, that really is the key to a lifelong career that will be satisfying for you and happy for you, is just figuring out whatever it is that you want to do with your life. That being said, when you come to the interview, we will probably ask you, what do you think you're going to do when you grow up? We understand, like, you know, you can change your mind. It's okay. Like, we all know that it's okay to change your mind. You don't have to have like a concrete career plan, but we'll probably ask like, what are you interested in, and sort of where do you think you'll be in 5 years or so? I think is not an unreasonable question to expect.
And fellowship in emergency medicine is pretty different than others. I mean, I think what everybody's saying, like, it has to be a passion project for you, because fellowship in EM, I mean, I don't, and we don't usually talk about like money or salaries or that kind of thing, but it actually will, give you an academic track. It might actually reduce your salary compared to other fields where fellowship increases your salary, and it might tie you to a specific academic center. So it should be something you really want to do. And I think that having something that sustains you, that's really what it should be about. And you think about like the heart of what the fellowship is there. It's either to make the connections or to actually learn the educational training and like how to put together that part of it. I mean, that's the kind of the hallmark of the fellowship. So I think exploring the different areas and niches in emergency medicine throughout your residency is really, really important. And it'll hopefully let you know whether that's a wise decision. Yes, maybe in like very difficult markets where like jobs might be like tight, having a fellowship probably would help you. But I think that you'll get a lot of good guidance about like what would be the right fellowship for you if it's the right choice for you.
Dr. Garg, did you also want to finish your thought from earlier?
I was building up. I was on a roll. I don't know where I got cut off, but I think we have a really unique opportunity to not just be your friend, but like your mentor, your advocate, your champion. And I think that's a really, really cool thing. And Kwame, if I would just say, whenever applicants talk to me about academic medicine or like, how do I do what you do? We try to give them the building blocks and talk about the different ways and how much we're going to support you in that process. We know that, 80% of the people that talk to me about academia, they don't do academia, and that's okay. I think that's the whole point, is we want you to be that person that can handle anything at any time, any place, right? And so I think one of the things that we love to do is not just build academic doctors, but we want to build global health folks. We want to build great people who are going to be out in rural America. Like if it's wherever you want to be, we want to give you that skill set. So I think anyway, I think you're going to get really great mentorship about that. And if you talk it, we'll love to hear it, because it's a small club, but we'll always welcome for more.
I appreciate you finishing that, Dr. Garg.
Did any other PD want to chime in? If not, we'll go to our final question for the night. All right, so our last question for all the PDs is, if you were a fourth-year medical student again, what quality about your program would draw you to do residency there? And let's just go in the order that we went in before. So Dr. Botkin.
Great question. I loved my residency. So I did my training at the University of Rochester, then stayed on as faculty member. So it's kind of an easier question for me because I knew what I was looking for and what I got. And it certainly would be two things. Probably the connection that I had with my residents. I think fit, like we've all said, is incredibly important. I think if you go to a place where you're going to be happy and it's a place where you fit in well and you're happy outside of emergency medicine, you're going to get great training at all of these programs as well as the other accredited programs across the country. So finding a place where you fit well and the place fits you is going to make your training so much more robust and make you so much happier and make you a better physician in the end. And that also is my second point, is it creates lifelong connections with all of these incredible people. So finding places where you're going to get great mentorship and where you're going to get to meet people that are like-minded, that are going to help you move your career forward, I think is really powerful. So those are the two things I would really look for. I know you said one, but I snuck in two, and go Bills.
Thank you. Dr. Garg?
Yeah, it's so hard to encapsulate this as one, but I would say that, when we keep talking about fit, we keep talking about like, are these your people? Is this my crew? And so that to me is what I think you really need to know, because we all know that you've been on a third-year rotation, fourth-year rotation. If you're working with people who are like-minded and similar and are excited about medicine and excited about taking care of people and want to use resources, if that's your group, and if they fit, and they're going to like maximize the best version of you, that's where you really want to be. And so I think that I trained at Detroit Receiving County Hospital, one of the oldest emergency medicine programs, gun and knife club at the time. I loved it. The people were my people, and it's like set me up for a future of success. And so I want that for all of you too. So I think your assignment, and you should choose to accept it, is the fact that you need to find the place and find out what that character, what that personality, what that fit is at a different program. And that's what's going to help make you succeed and really be the best version of yourself.
Thank you. Dr. Leuchten?
Yeah, I knew Barnabas was for me. I trained there, and I got to be the PD there because I knew they had my back, and that's what I felt when I walked on the floor the first time.
When are you done? Thank you. Dr. Caputo and Dr. Hussein?
So back to an earlier question, being a PD now is a lot like having your kids in the background like that. All of us seem to have kids and they jump in at the right time. So that happens a lot to us. But to answer this specific question is, what I didn't have in residency that we have on Staten Island is protected Tuesday nights. And I think that really sets the tone for our program because our residents are all off on Tuesday night. They're always in conference. When I was in residency, we could just sign in the morning and that counted as attendance for conference, and we weren't protected Wednesday mornings, Tuesday nights. So I didn't get as close to some of my fellow residents as I see my residents. So my residents are together, sitting together every single Wednesday unless they're on vacation, and they plan activities and go out to eat on Tuesday nights. They really gel, and it's really goes, all of our graduates are super, super tight. And I think that really sets the tone for our program. Abbas, anything you'd like to add to that?
No, nothing else. I think you said it well.
Thank you. Dr. Jones?
So I think I kind of go back to when I was on my interview, and the program director at the time, who's still a program director in New York, just not my program director anymore. But Tom asked me, where do you see yourself in 10 years? And I said to him very clearly, you look like you're having a lot of fun. I kind of see myself in your seat. 10 years later, I wound up taking over the program at Jacobi and Monty. The thing that I think I felt there is that there was just a shared passion and a shared ethos, a shared commitment to a community. And that I think is something so valuable and so special. And I think it's something that we're all saying just in a slightly different way. It really truly is about the people in this experience. And so that's what I think I would really be going for at that point.
Thank you so much. Dr. Chung?
Oh, thinking back to my fourth year medical school self, I think the thing that would have drawn me the most to Maimonides was just how much the residents seemed like three-dimensional human beings, right? So they weren't just sort of residents, right? But they were people that had pets and grew plants and lived in Brooklyn and went and did fun stuff. And when you got together, it wasn't just all work, 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 work. And so I think of the things that I was looking for, that was probably maybe one of the biggest qualities that I was searching for, that I would have definitely found at Maimonides.
Thank you. And last but certainly not least, Dr. Rizzo.
So I think something that we would offer my fourth year medical school version of myself would be a seat at the table and having a voice heard. And I think whether you're an intern on your first couple of weeks in your first rotation, or you're a senior trying to figure out what the next steps are and how to live out your legacy of the program, I think having a seat at the table and being able to talk openly and freely, and knowing that you're in a comfortable place where people are truly listening to you, I think that's the type of program that I would want to be at. So if that also interests you, then that's something that we have to offer. And I think a lot of these programs have something to offer very similar.
All right. Well, thank you so much to everyone who joined us tonight. Hopefully we'll see you at the next event. Take care, everyone.
Thank you.
Thank you.
Thank
you very much.
Thank you.
Thank you.